The CMC arthritis can affect people that are anywhere from their late 20s up till their 60s or 70s, depending on how their joint ages. In younger patients and patients who are very active, I like to use the ensemble, or at least offer that to them initially, because it resurfaces their existing bones and gives them a functional strength and activity level that is much like they used to have before they developed the arthritis. The traditional way of treating CMC arthritis is to remove one of the bones and suspend the thumb with an anchor or with a suture wire in order to take away the pain so that the bones don't rub together anymore. But it does come at a cost of strength. So you'll lose probably 30% of your grip strength by taking out that trapezium. And if you're not particularly active, that may be okay, but the ensemble implant will allow you to remain at your current activity level and not have that decrease in strength.